This week in Story of Success, we catch up with Dr. Abbassy, one of the young Egyptian doctors. He leaves you with a sense that his field seemingly with kind of inexhaustible energy. A big factor in his story is that he constantly sought to push boundaries that defined his work. His success story is built on the foundation of devotion. This is Story of Success for this week. Find out if doctors can do well fighting for national projects. Landmines beside being a threat to the life and safety of individuals, landmines in Egypt pose a severe challenge to economic development efforts. Over the past decades, the gravity of this problem has unfolded as landmines have caused the death or injury of thousands of people in western deserts, Sinai and Suez Canal zones. In addition, landmines have disrupted economic development efforts in these parts of the country. Still, this problem will look graver if we recall the fact that of all countries of the world, Egypt is most afflicted by landmines. He was a part of a medical caravan to Sidi Barani. Plus, mobile phones, do they have any kind of negative impact on babies? He decided to step in and do some research, and these are the results. Also, infertility raises its head both for men and women alike. His take on how lifestyles can be part of the cure. Let's get started. We're now here in the National Research Center, and you have an important research about the effects of electromagnetic waves of the cellular phone on pregnancy. Tell us more about that, please.
Bismillah ar-Rahman ar-Rahim. First, I would like to welcome you here in the National Research Center. I'm very honored to be on your prestigious show. It's a great honor for me to be on this show. Regarding my research on the effect of electromagnetic waves on pregnant women, this was a research that was conducted here in the National Research Center in collaboration with Asr Aini Cairo University.
You supervised this research?
Yes, I did this research by myself and with the help of other colleagues. And we were experimenting the effect of the mobile phone. This is one of the very famous questions that the patients come to us, and they start asking us, is there an effect of mobile phones during my pregnancy? Is it safe to use the mobile phone during the pregnancy? For you to give a very accurate answer to the patient, you have to be supplemented, or you have to be evidence-based. We did this research, and we tried to use the mobile phones for 5 minutes, and we asked the women to report to us the baby's movements, and we had a special device called a CTG connected to the women, and we were trying to investigate if there were any significant changes in the fetal heartbeat during the mobile phones.
The heart of the fetus.
It does not affect. This is what the research have shown, that
then there's
during
no relationship between the mobiles and
that there is no short-term impact on the women. But after we did this research, other researchers in Norway, they were very interested in the idea, and they started following up the patients when these babies became about 6 years old and started going to school, and they started to observe if these babies or these children had any behavioral changes, and they actually found that there are significant behavioral changes on the long term. Our study was on the short term, and this was later on continued in other countries abroad, and they found that there might be changes in the longer term.
So we're notifying pregnant women to take care.
Yes, be careful.
Also, you participated in Rotaract Medical Caravan for providing medical services for the victims of the landmines in Sidi Barani. What's the importance of that?
This was a medical caravan that was conducted by a very famous group, and they were trying. There's a place called Sidi Barani. It's a place between Libya and Egypt. This place had landmines from the World War, And there was a lot of victims from these mines, and some of them, they lost limbs. They lost their legs, they lost their hands, and they were providing them artificial limbs, through donations. And we were also treating the women in these urban areas because they did not get the adequate medical services that they require. So we were trying to get medications and start employing doctors and start putting them there to help the people, to help their suffering, to help to stop the diseases that they could undertake at this area.
Okay, as well you attended actively in a UN model as delegate for France in the International Atomic Energy. Tell us more about this.
This was actually during my medical school when I was still a student. There was a very nice event that was held by the American University in Cairo. They did a model of the United Nations. And in this model, it's represented by different categories. One of them is the International Atomic Energy Agency. And I was the delegate of France at this time. And you start to discuss the political issues, and you start to get a grasp of the different policies of the different countries. And you learn to interact with people from all over the world, because at this event you have people coming, students coming in from all over the world. It gives you an experience in trying to deal with different cultures and different backgrounds, and trying to grasp the different, it's always important to know how people abroad are thinking about, and to know their policies. So it was a very interesting experience.
Now we'll talk history a little bit. Why did you join Faculty of Medicine at the beginning?
Okay, at first, when I finished my IGCSE, which is the English diploma in my English education, I was really intending to go into computer science. And this was my main aim, and I started actually working as a web designer. I created web pages, and this was very interesting for me because the internet was something was quite new at the time, and it was very compelling for me. And I started to design web pages, and I started to become very professional in the HTML and the computer science. And then
why did you make this turn?
And then I discovered that I'm a people person. I like to interact with people. If I started if I entered computer science, I would always be interacting with the computer. I won't be enjoying the interacting with people and listening to them, which is something that I really enjoy. I decided to go into medicine. And at first, medical school is quite, the first couple of years is more theoretical than clinical. And this was a great disappointment for me in the beginning. I thought that, oh my God, all of this is just books, and just you have to start studying and memorizing and then go to the exam. There was not this doctor-patient interaction, which is quite important for me. But later on in medicine, after the third year of medicine, you start to interact with patients, and you start to learn diseases, and you start to follow up the patients. And this was the part that I really enjoyed, because I enjoy seeing how grateful the patient is for your hard work and for your strive to make them feel better. For this, for me, was very satisfying. And then towards the end of the medical school, you come to a decision, what are you going to choose, your specialty? And this, of course, took a lot of time and a lot of...
thinking.
Yes, a lot of thinking. It was not an easy decision to think about it. But
to be stuck with the ladies all the way.
Okay. The main reason I chose gynecology and obstetrics as my profession, because first of all, it's a very happy branch. You see the people always smiling and always very satisfied with you. So it's not a very depressing. It's not a very depressing career. It also has a lot to do with ultrasound, which I was very interested in. You employ the ultrasound during the antenatal visits and during the visits of the patients to your clinic. Also, it has a lot of very compelling surgeries, whether laparoscopic surgeries. This is surgery using very fine instruments inside the abdominal cavity and dealing with the tissues, handling with the laparoscopy, or endoscopy as a hysteroscopy, which is entering through the cervical canal into the uterine cavity. And all of this was very compelling to me. A branch that has a lot of surgery, it has a lot of ultrasound. It's the mood of the branch is quite cheerful. So this, for me, was quite a compelling career.
You attended many seminars, and of course, you did many researches on the infertility of men and women. Tell us more about that.
Okay, infertility is one of the problems facing all over the world, and it is increasing. The incidence of infertility is about 10%.
What are the figures worldwide and in Egypt?
Yes, in Egypt it's about 10 to 20%. So this is not a small issue. It's a very important issue, because out of every 10 women or every 10 couples, you might find 1 or 2 that have a problem with conceiving. This is a major problem. This is why I was very interested in conducting research and attending workshops all over the world in order to try to give the patients or to deliver the best quality service to the patients here in Egypt and abroad. I'm one of the very few doctors here in Egypt that provide the patients with a 4D gynecological ultrasound. This means that we visualize the whole uterine cavity. Yes, we visualize the uterus and the fallopian tubes and the ovaries.